Cathaoirleach, and I know this item will be of interest to you and indeed to everybody in Kerry, and I thank the Minister for taking the time to come into the House to give us an update on the issue of the staffing levels in Kenmare Community Hospital, which, as the Minister would be aware, is open since 2013. In fact, the official sad turning by Senator Riley, as he is now, but then Minister for Health, happened on the 3rd of February 2012. And yet since then, despite the government spending $8 million on this new facility, there are only 19 of the beds opened at this stage, and there are 21 remaining to be opened. Now bear in mind that's 6 years where we're waiting for the opening of the second floor on the hospital, and the excuse that has been given time and time again in this House is the issue of recruiting. Now, we are producing far more nurses per head of population than most European countries, and yet we are exporting most of them. And they're being given job offers in England and Australia and the Middle East, and they're taking those jobs up. And yet, for some reason, the offers that are being put out there every year by the government, every 6 months, and putting it on the list, they're not being taken up. And the reason they're not being taken up is simply the pay isn't good enough, the conditions aren't good enough, and yet the excuse for not only Kenmare Community Hospital but Dingle Hospital, which is 14 million, was spent on that. There was 60 beds provided and only 43 are open, again because of the lack of nurses being recruited by the HSE. So I would ask the Minister to outline, and I hope it's not the same reply I got 6 months ago or a year ago or 2 years ago or 2.5 years ago or every 6 months that I'm allowed to ask this question, that it's simply that they're still trying to recruit. 6 years on, if they're still trying to recruit for this hospital and all the other hospitals that have vacancies in them, then the government obviously have not identified that the true problem is the government, in that they are the ones who are not giving the proper terms and conditions, and that's why people aren't taking up the positions in this hospital and all the other ones as well. Thank you, Cathaoirleach.
Thank you, Senator. Minister.
Carla, first of all, I want to thank Senator Mark Daly for raising this very important issue, and of course I would share your concerns about this particular issue, but I am also taking this matter on behalf of Minister Jim Daly. Residential care, Carla, is provided through a mix of public, voluntary and private provision. It is worth highlighting that the net budget for long-term residential care in 2019 is €985 million, and over 23,000 clients on average at any one time will be in receipt of financial support. Over the last 2 years, an additional €45 million has been provided to the Nursing Home Support Scheme budget. In 2020, the NHSS will see a further investment into its budget of €45 million, bringing the total annual budget for the NHS to €1.03 billion. Public residential care units such as Kenmare Community Hospital, County Kerry, are an essential part of our healthcare infrastructure. In total, they provide about 5,000 long-stay beds, amounting to 20% of the total stock of nursing home beds nationally. There are also about 2,000 short-stay community public beds. The Health Service Executive is responsible for the delivery of health and personal social care services, including the Kenmare Community Hospital. HSE Community Healthcare Organisation 4, which includes County Kerry, is committed to delivering services for older persons through a community-based approach that is supporting older people to live in their own homes and communities, and when needed in residential care such as Kenmare Community Hospital. Currently, there are 19 beds open at Kenmare Community Hospital, with the potential to open up another further 21 in the future. While the HSE had planned to open a number of additional beds at the community hospital on a phased basis, they have unfortunately faced challenges in recruiting the extra nurses needed. The existing nursing staff complement for the 19 existing beds is 8.66 nursing home time equivalents, along with 7.86 healthcare assistants. However, in order to open an additional 9 beds, a further 5.11 nursing WTEs are required. So another 5 nurses are required to open the 9 beds. I have been assured that the increasing capacity at Kenmare Community Hospital remains a priority for the HSE, and that they are continuing to make intensive efforts to recruit nursing staff. I am also informed that the Executive has run 3 recruitment campaigns in the last year alone, the most recent recruitment campaign being in September 2019, when every effort is made to recruit the necessary staff. Unfortunately, no suitable candidates were recruited at that time. The HSE fully understands the importance of Kenmare Community Hospital to the local community and appreciates the excellent care provided by the staff there. And I note that the recent inspection report published earlier this year by the Health Information and Quality Authority acknowledged that the centre was warm, it was bright and comfortable and met the needs of the residents. So we have great confidence in the hospital. In general, the inspector observed that the care and support given to residents was respectful, was relaxed and was unhurried. Staff are familiar with the residents' preferences and choices and facilitated these in a friendly and respectful manner. The local HSE management has assured the Department of Health that they will continue to work to extend the services in Kenmare. The HSE has informed the Department that the hospital has an excellent reputation locally as a care facility and that the welfare of its residents is a priority for staff, management, and that they are deeply appreciative of the support the hospital receives from the families in the wider community. And in line with the usual process, the HSE will continue to review all of its services to ensure that the continued provision of high-quality, value-for-money residential care with the older person at the centre of all decisions made. But of course, if you have genuine concerns, I will bring them back to Minister Jim Daly on this particular issue.
Thank you, Minister. Supplementary, Senator.
Yeah, thank you, Lasclear, and I'd like to thank the Minister for taking the time to come in and give the reply on behalf of Minister Jim Daly. And I suppose I'll focus in on the value for money element, and there is no value for money in having a facility that cost €8 million and half of it empty, and have half of it empty for 6 years. And while the Minister points out that no suitable candidates were recruited at the time, the issue behind all of this is the terms and conditions in which are being offered to staff by the HSE, and this is not just a Kenmare issue or a Kerry issue, this is a nationwide issue. And yet at the same time, in the issue of value for money, agency nurses are being brought in at the cost of hundreds of millions per annum to fill the void in the hospital services. So I go back to the point that it is really about the overall issue of terms and conditions for nursing staff within our health sector. That is the problem for Kenmare Community Hospital, and the fact that people are in Dingle being sent outside the peninsula, a case of a 90-year-old woman not being able to be cared for in her local community because the beds aren't open, because the nurses aren't hired, and the nurses aren't hired because the terms and conditions aren't as they should be. They're giving them the money in England, we're training them, and England, Australia and the rest are benefiting from our nurses that we are training, but simply not willing to pay them enough. And that will continue, and I will be back here in 6 months' time, hopefully not asking the same question and hopefully not getting the same answer. But I'd like to thank the Minister for coming to the House. Thank you.
Senator, Minister.
Again, I absolutely accept the valid points that Senator Martelli raises in relation to Kenmare Hospital. And can I say that I fully acknowledge, and the HSE acknowledges, the importance of the role that the facilities like Kenmare Community Hospital provide to the people of the Kenmare region. The welfare of residents is a priority for the staff and managers, who are very appreciative of the support the hospital receives from the families and residents from the local community. The HSE, though, cannot open additional beds unless the appropriate level of nursing staff is in place to ensure the service provided is safe and the optimum quality for elderly residents who require professional nursing care. But of course, I do take on board your points about nurses leaving the country, highly trained. Of course, that is a very valid point. And then also your value for money economic argument on the €8 million to cost to build the hospital, and you're saying the beds the wards are half empty. And then your other point about the nurses' terms and conditions, and also the high cost of agency nurses. This is something that I regularly say in government myself, that a lot of the resources could be spent in that direction. But can I say, I'll bring your concerns back to the Minister, and on that basis, the HSE will continue to make every effort to recruit the nursing staff for Kenmare Community Hospital. Thank you.